Hey everyone, and welcome back for a Wednesday edition of Lunch Break Live with me, Ivana. And today I am joined by UAB's infectious disease, Dr. Jodie Dionne. Now, Dr. Dionne here, she is an assistant professor in the Division of Infectious Disease at UAB, and she's also the chief of women's health at the 1917 Clinic. So Jodie's here today to answer some of y'all's questions that you have about coronavirus, about the precautions, masks, things like that. Y'all asked a lot of really good questions yesterday when Lita and I went over some of the data and some of the numbers that are coming out in the counties across Alabama. And y'all had a lot of questions about a possible second wave of coronavirus and also about why case numbers are rising in certain areas and not in others. So y'all had some good questions. Lita and I answered what I could, but I wanted to bring the doctor on today to answer and give you a more in-depth look at some of these questions. So first, doctor, thank you so much for taking your time. I know you're very busy.
I'm happy to be here. I love to answer questions.
Thank you so much. Well, first, the question that everybody wanted to ask yesterday is, do you anticipate, and your colleagues in the infectious disease world, anticipate a second wave of coronavirus?
So my problem is really calling it a second wave, because when you look at what the numbers have done in Alabama, the numbers really slowly have risen and stayed more at a plateau. So I think we're still experiencing the first wave, which is a very long prolongation and not really an up and a down like you see sometimes in epidemics. So yes, we're increasing. Yes, we worry that the cases will increase more, but is it a second wave? No, we're still on the first.
Interesting. Now, I know you said we are kind of at a plateau here in Alabama. We're not yo-yoing like some places. Is that a good thing, or do we need to be on a downward slope by this point?
Yeah, it's a really good question. So I would say we were on a plateau. For a while, we were looking at about 250 to 300 new cases a day, and that's with relatively constant testing numbers. So you remember at the beginning, we had no cases and no testing. So once we ramped up testing, the numbers of cases did increase. But with a pretty consistent level of testing now over a period of weeks, we're seeing that number increase from 250 to 300 cases a day to 400 cases and above. And yesterday, the number of 663 cases was definitely concerning for all of us when we saw that number.
Right. That's something we talked about yesterday. And I think some people definitely saw that number on the Tuesday after the holiday and their minds immediately went to, oh, Memorial Day. But that's not exactly accurate, because we don't know how Memorial Day and the long weekend and the crowds that we all have seen at the beaches, we don't know if that has increased the case number yet, because those numbers are not reflecting our latest weekend, correct?
Correct. So you have to remember that this virus has about a 5-day incubation period, meaning that if you were exposed to someone on Monday, Memorial Day, chances are you wouldn't really have symptoms until Saturday. So I think these numbers are reflecting some of the relaxation of the safer at home orders, but not Memorial Day. It's too soon. You're right.
Got it. So good question from Val. I think, she heard when we started talking about that plateau, she said, so does that mean that we flatten the curve?
It does. I would say, remember, the first thing we were trying to do is, as the cases were starting to increase, was saying if we have too rapid of an increase, this can overwhelm the capacity in our state in terms of the hospitals and ICUs and testing, all of the personal protective equipment. So everything that we did with the schools and staying at home made a difference in the sense that it did flatten the curve, yes. But unfortunately, everything that we did flattened the curve, but it didn't make the curve go back anywhere near zero. So we saw the national guidance that said what we want to do is reopen after we have 14 days of consistently decreasing numbers. I don't think any states, or very few states in the US, were able to have that before they reopened. And reopening means people going out again and potentially spreading this virus more. And remember, if every person infects one or two other people, those numbers can take a while to rise, but when they start to rise, they can then rise very quickly. It can be exponential growth as it starts to spread. We're again trying to prevent that. That's what we're worried about.
Got it. And again, I know some of y'all are already putting your questions, but if you have questions for Dr. Dionne, she's here and she is ready to answer them. So let us know. While we're going to just keep getting into these questions because people had really good ones. I got a couple from Twitter. I've written down right here. Michael from Twitter asked, should I be wearing my mask in stores and public places? And do you and your colleagues in the infectious disease world believe that masks should be mandatory?
It's a really good question. And I think it's really important to sort of clear the air about this, because there has been sort of changing guidance on masks. At times wear them, at times it's not necessary. What we know from the science today, from other countries and from the US, the mask is effective. The mask prevents some of these small droplet particles from coming out of your mouth and getting into the air, getting on surfaces and infecting other people. So the mask is really to protect other people from you, and their masks protect you from them. We all in infectious disease are wearing these masks. So we don't just recommend this for other people and then not wear them ourselves. But every time I leave my office where I'm here by myself, my mask is on my face. And when I'm out in public where I have the potential of coming across other people, the mask is on. You don't have to wear it in the house. And you don't have to wear it if you're outside in a place where you have lots of separation between you and other people. But a grocery store, if you're at the post office, if you're going to the bank, remember the worry about coronavirus that we understand now is some people can transmit it even though they feel fine. So we still are talking a lot about symptom checking and staying home if you're sick, which is absolutely appropriate. But you shouldn't feel like you're safe if everyone in the grocery store looks healthy, because there could be people there who have the virus in their nose. And if they are too close to you, they could spread the virus to you. So that's a reason for the mask. Yes, I think it's a good idea. Is it perfect? No. But it's a simple measure that we can all take that protect you and your family from having this virus come into your house. I think it's a good idea.
That, you bring up a good point about you could be around somebody that doesn't even know that they're sick or doesn't realize that they have the virus, and they could be contagious and not even be intending to pass that on or intending to cause harm, but they actually could be.
Exactly. So what the studies estimate is as much as 30 to 40% of the coronavirus that's being spread now in the US is from people who don't have any symptoms. So for example, we know that children can have high levels of virus even though they feel fine. And this is a common phenomenon for children to spread viruses even though they don't look sick. But it's not just children. There are some adults. When we look in their nose for the virus, we find very high levels of virus in the nose. And you ask the person many times, have you had fever? Do you have any muscle aches? Do you have sore throat? They say, no, no, no. So it doesn't mean that symptoms are wrong to ask about. It just means we shouldn't trust the symptoms to be 100% accurate at identifying who has COVID.
Interesting. Now, talking about masks, I've got questions from both Sarah and Beverly about the types of masks to be wearing. They say, is it okay to wear a cloth mask and not an N95? Because I'm assuming they don't work in the healthcare field. They're like me walking around. Are those cloth masks effective even if we don't have the medical grade N95s?
Yes. So the recommendation is for the general public, if you're not a healthcare worker, to wear a cloth mask. So you want to have something that's comfortable, that's not going to stifle you. You want to be able to breathe. But most of the cloth masks you see people wearing when they're walking outside are exactly that kind. It's you can make it yourself. You can buy it online. There's several good ones. What I would caution you is I have seen some that have like zippers that open so you can eat and drink and talk to people, and that defeats the purpose of a mask. So I wouldn't wear anything that opens like that. But if you have a mask that's comfortable that you can wear, that's what you want to have. The purpose for the N95 is those are specially fit masks for healthcare workers to wear. We wear it when we see patients with tuberculosis, for example, and that prevents any airborne transmission. But the regular masks that we're talking about with cloth are meant to prevent droplet transmission. So you don't need an N95 to go outside. That would be too restrictive.
Now, I do know that some of these masks, I know the ones that I've gotten from people in my neighborhood that have sewn them, which is I'm very thankful for because I cannot sew them. But a lot of these masks have a hole in the middle where you can put some sort of filter, be it a coffee filter or some other sort of material. Do you recommend people that are not in the medical facility like yourself, but people that are just walking in the grocery store, et cetera, that we put a filter in those masks?
I think the filter is not a bad idea. I think it's not necessary. The purpose of the mask, remember, is to catch your droplets. If you're coughing or talking, and all of us are I'm releasing droplets talking right now. So that's the purpose of the mask. The filter is another barrier, another layer to catch that, but it's not necessary. The cloth mask, even without the filter, is effective. So if you have it and want to use it, it's fine. If you don't have it, don't worry.
There's we have I know we have a lot of questions about antibodies, about people that have already had COVID, but Ricky asks, if you've already got COVID, and you've already had it and you have survived it, do you need to wear your mask when you go in public?
Yeah, so that's a good question. The recommendation is that everyone should wear a mask when they go in public, and partially because we don't have enough information about these antibody tests to really be good at identifying who's had infection. We think on average about 4 to 5% of people in America have had COVID. It's higher in New York City, obviously, but most people have not had it and are still susceptible. If you did have an antibody test, then that would, and it was positive, that would mean that it passed through you. And if it's been some time and you feel fine, the chance of you being infectious is low, but there are people who have antibodies and still have virus in their nose. So I don't think you'd want to make the assumption that just because you're seropositive that you can't still be carrying it. You can be a carrier even though you already had it, if that makes sense. It's sort of complicated.
No, that's really interesting. And talking about people who have already had COVID, let's get into this question. Everybody wants to know is, can you get it again? And if you can, how long do those antibodies give you immunity for?
Yeah, so these are the million-dollar questions in our immunology field right now. What we can tell so far, remember, this virus was only identified in January. So it's not like we've had 3 years to understand how long protection lasts and how likely it is. What it's looking like, both from human studies and animal studies, is that people who get COVID develop good antibody responses. Those antibody responses help you clear the infection, and those antibody responses are detectable even after the infection is gone. How long it lasts is another question. We know for some types of coronavirus, the antibody only lasts a period of months. We know for SARS type 1, the antibody lasted for years. So a lot of us are hoping that it's more like the SARS-1 response, and this will protect us for a long time. That would also be great for a vaccine. You can imagine if you could vaccinate someone once and have that last for a long time, that would be ideal. We don't have the scientific data to be sure about that yet. So yes, protection seems to be happening. Number two, the question about how long that lasts, we just don't know yet.
I know that there are, when you look at the flu, there are multiple strains of the flu. I know you can get a flu shot that protects you maybe against A, and then you still get B.
Right.
I know because that happened to me this year. So anybody that, it is possible. Coronavirus, are there different strains of the virus right now, of the COVID-19 coronavirus? And also, if and when we get a vaccine, do you believe it will be a similar situation?
So coronaviruses as a family are really common. If you look at young kids who have the sniffles in the winter, 20 to 30% of them in some studies have coronavirus. It doesn't usually make them very sick. They usually recover, and they don't usually infect their parents. It's something that adults, we see it less likely in adults. SARS is different. SARS did have a much higher mortality rate, about a 10% mortality rate, but it didn't spread around the world the way this coronavirus did. So this coronavirus, the receptors it attaches to is different. It's a whole different beast. So I don't think you want to assume that we know now that it's not acting like that regular seasonal coronavirus that's asymptomatic infection in kids. It's much more of a serious infection that impacts older adults more than younger adults. What the virologists do is they look at the COVID virus in people in China and people in Europe and people in America to understand if it's mutating or changing over time. And fortunately, what they see is for the most part, this virus is changing only in very small ways. So the extrapolation of that is that once we have an effective vaccine, we do expect it to work even as the virus has these small changes. To contrast that with HIV, I take care of a lot of patients with HIV. One of the reasons why a vaccine for HIV has been so challenging to create over 40 years is the fact that this virus mutates every day in the patients, and there's many different strains in everybody. That's not the same thing for COVID. Fortunately for COVID, most people have a similar strain. Do they look a little bit different for someone in California and someone in Japan? Yes, but not so different that we think that the surface proteins are going to change and not work with the vaccine.
So that we got a question from, I believe it was from Joe on Twitter, is have there been any recent signs of mutation in the virus for better or for worse?
So yes, there's always mutations in viruses. So as viruses make copies of themselves, they have enzymes or machinery that makes them make imperfect copies. And that's part of the way that viruses thrive. So we can tell over time which virus came from China, which virus came from Europe, based on the similarity of the sequences in the US to these other sequences elsewhere. So like I said, some of the changes that we're seeing in the virus are minor. So one base pair change or two base pair changes, detectable differences, but not big enough of a difference to make the virus act differently, behave differently, infect cells differently, or become more infectious over time. The virus is incredibly infectious. It's been incredibly infectious. That's not changing.
Interesting. Good question from Eleanor. She's saying, why is it taking so long to find a cure since this is worldwide? We have so many minds looking at it.
A great question, Eleanor. I would say that there are so many people, just like you said, literally 24/7 labs trying to understand how to build a good vaccine. We know that this is the way for really to get out of this is with a good vaccine. So I think that the progress that has been made has been incredible. From the first case reported to the virus being sequenced took 9 days. So again, I mentioned that was back in January. And as soon as that virus was made available to the scientific community, they immediately started looking at different types of vaccines. So there's different types of vaccines. You can have DNA, RNA, subunit protein. All the different teams would use their experience to work on a target, mostly targeted at this spike protein on the surface of the virus. We're in May now, so it's been 5 months, which seems like it's been a very long time, but that is really rapid that we are already moving some of these vaccine products from phase 1 safety studies into phase 2 safety and efficacy studies. We haven't had that rapid of a progression for other vaccines before. You may have heard the statistic that the fastest vaccine we've developed in the past was a vaccine that took 4 years to develop. And we're already on a much better track now since the early results for the vaccines we have are looking very promising. So this doesn't feel fast, but I do want to tell you that as far as it takes to develop a safe and effective vaccine, this is actually moving very quickly.
And it's interesting that you noted earlier, I know that you work at 1970 Clinic, you deal with a lot of HIV patients, and they've been working on a vaccine for that for 40 years, as you said. So I think time is definitely relative when it comes to our daily life versus vaccine life.
It is, but I mean, since this is the what everyone's hoping for to be able to come out of stay-at-home orders, I mean, every single day everyone wakes up and wonders, is the vaccine ready yet? So just rest assured that as long as we keep promoting science and promoting scientists and having them do their best work and work together across countries, across companies, I think we are on a really good track to have not one, but maybe even more than one effective vaccine. Then the problem will become, or the process will become, how do we make millions and millions of doses of that? So for everybody who wants one.
I keep looking, my eyes are darting to the side watching all of our comments. We're getting a lot of them, but I want to shift as to a couple that I saw on Twitter that I wrote down over here. And this deals with ICU beds and hospitalization rates. Now, I know the hospitalization percentage, or rather the amount of people in Alabama who have tested positive, the hospitalization rate is fairly low. But we have some questions on Twitter about what are hospitals, including UAB, doing to prepare in case there are more ICU beds needed. We've all seen the spikes happening in the Montgomery area, and we have heard that some of those patients have had to be moved to other hospitals. So what are you and your colleagues in other hospitals, if you know, doing to prepare for that possible spike?
So the numbers that we understand about this virus, I'm sure you've heard this before, about 80% of people have relatively mild illness. About 15% of people end up needing to be hospitalized, and many of those are hospitalized needing oxygen therapy, but not needing intensive ICU level care. About 5% need ICU level care. So one of the reasons why we follow the case counts so carefully and we worry is not that I think that all 663 cases reported yesterday are going to end up in the ICU, but 5% of an increasing number starts to overwhelm systems. If that goes to 10%, the ICU beds that we have are sort of fixed in Alabama and in every state. You can't magically create an ICU bed. On the other hand, there are emergency plans and pandemic preparedness teams who literally have been working for years for something like this to say, What do we need to do when we have someone in Mobile who is incredibly ill and they don't have the capacity anymore to care for them? How and when do we transfer them to Birmingham to be able to provide that level of intense ICU level care? So what that means is we have teams in the ICU where we have dedicated COVID units and the ability to open and close certain COVID units. As we get an influx of patients, we open up certain units so the nurses and the doctors and the residents and house staff working are all taking care of COVID patients focused in that unit where there aren't other patients without COVID. We would like to keep that number small because nurses and doctors and teams are not a limitless resource. At some point, every system gets overwhelmed, and you don't want to be the person in the ICU when everything is overwhelmed. So that's driving a lot of the discussion that we're having. I know sometimes it seems like the doctors and the public health experts are like trying to put a buzzkill in summer. And I think that if people could walk with us and see the patients that we're seeing and seeing patients, even young, previously healthy, on a ventilator, on their stomach, very sick for days, you would understand, this is not a mild disease. For some people who get very sick, it's a very serious disease. And for, let me get the number right, 580 people in Alabama, it's been lethal. 580 mortalities is an incredibly high number. And that's what we think of when we're talking about masks. That's our perspective.
Right. And I'm glad you brought up the summer and how a lot of people are very upset to hear about some recommendations that doctors are giving for the summer period in the time where a lot of things are happening outside. A lot of people are gathered together in groups that are not socially distanced. So what is your thoughts on things like pools and different outdoor festivals, cookouts, things like that, the typical summer activities for most people? What does our summer look like this year?
So I don't think this has to be couched as like a totally black and white. You either get to go out and do everything or you have to sit at home and sit in a dark room by yourself. I think that there are ways to assume some risk in a safe way. So what I ask people to do is sort of calculate for yourself, think about your own medical conditions and the people who live in the house where you live, think about your kids and your grandparents and people you come in contact with, think about their medical conditions too, because this really is never just about one person. It's about all of us in Alabama trying to keep the virus from coming into our communities. And we can only act if we do everything together. So that said, the places where this virus spreads very easily person to person is large settings indoors. So we've seen cruise ship settings. We've seen outbreaks in prisons and in nursing homes where people can't move around easily. Those types of settings of hundreds of people packed indoors is the perfect setting for a virus to spread. So I would avoid all of those because that's where your likelihood of coming in contact with that person who feels fine but is carrying virus is the highest. If you look on the other hand at the low end, if you're going outside with your family to enjoy a nice, beautiful day, taking a hike in a place where there's not a lot of people around, that is relatively safe. That is a low risk activity where you're getting out of the house, getting exercise, which improves everyone's mental health, but less likely to come across the virus. There are ways to hang out with some of your favorite people in a safe way without having it be 100 of your favorite people. I think this summer is going to look a little different for everybody, but this is not permanent. These changes are not forever. The virus is not going to be with us indefinitely. This summer is going to be different than others.
When you say there are safe ways to do that and there are safe ways to be around the people that you love or people that you haven't seen in a while and you want to be, what do you mean?
Well, so what I mean is, let's say that you have very close friends who are neighbors and you want to do something together. So if your families together are 8 people, you could figure out how to have a gathering of 8 people where you're having a cookout and you're socially distanced because the kids are playing badminton or playing, soccer, and the adults are cooking, but the person who's cooking is standing away from everyone else. If you think about this, physical distancing, keeping 6 feet of separation, making sure no one is there with symptoms, and you're doing it outdoors, that's a sort of safe outdoor activity that you can do. On the other hand, you probably saw some pictures of the pools from this weekend. There are some pools in the US where there were hundreds of people packed very close together, not wearing masks, sitting in the pool for hours at a time. Just think as the virus for a minute. That's a very easy place for the virus to spread. I would avoid the latter and try to aim more for the former, understanding that we do have to get out, we do have to do the necessary things, and this is going to be with us. So you want to think of a plan that you have, what you feel comfortable doing over the coming months.
Right. We're going to take just a few more questions. I got one from Anthony who's asking about lasting effects.
Yeah, so I think that's a really important question. And in medicine, we're always worried about that because we tend to think of these viruses as the types of things that come and go, and then you have antibodies and you're fine. But the more we understand about the way this virus impacts the body, leading to small clots that can form, leading to severe disease, especially for older Americans, we do worry that some of the impacts on the heart, on the kidney, on the brain may be longer lasting. So I don't think we know yet, again, because it's only May, we're early in the pandemic. There's going to be a lot of studies looking at this, but I don't want to minimize the idea that some people who have severe infection may continue to have problems into the future. For how long, we just don't know yet.
And again, it's a lot of things we don't know about this virus and about this pandemic. And people ask, what do things look like a year from now? And unfortunately, nobody knows. Just like I said, a couple more questions. I know you're very busy. One, though, that I've seen that a lot of people have been asking is pools, are they safe? Can this virus be transmitted through the water? And what are the risks of going to a pool?
So, I mean, pools themselves, there's nothing wrong with the water. A lot of times, especially if it's chlorinated, they're created in that way to try to kill viruses and things pass person to person. So it's not the pool or the water, it's the proximity in the pool. It's how many people are in the pool when you're there. If you have a personal pool or you have a pool that just a few people are in, that is a place where it's where it would be safe to go. Again, keeping 6 feet is important, and wearing masks if you can, if you're around a lot of people. But the water itself, even beaches, the ocean itself is a fine place to be. When you mix in the fact that there are hundreds of people behind you who may have COVID, that's where the risk comes in. It's not the water, it's the people.
I'm glad you said that, because my other question was from Michael. He says that if you're staying outside with your family is relatively safe, why do people get so angry about families going to the beach?
Yeah, so what I see is a lot of people getting angry. And I think that a lot of that is everyone is frustrated and there's increased anxiety right now because all of our lives have changed. And I sort of see people lashing out at people in public or on social media. And I think we have to give everyone in the world a little bit of grace right now to understand that everyone is under extra stress. When I hear people hearing comments outside for wearing a mask, I mean, that is never helpful. You don't know what that person's situation is or why they're wearing a mask. So I think we have to work together and not make this into a me versus you, us versus them fight. If you're outside with your family and you all are the people who are living in the same household, then it's absolutely appropriate to do things together in the outdoor space. So people shouldn't be giving you a hard time about that. I think it's just a manifestation of everyone being really worried about this pandemic, which is appropriate.
Right. Well, I think that's a really good note to end on. And Doctor, thank you so much for your time again and for answering all of our questions. I think a lot of people got really good answers and very informative answers to things they've been wondering about, and that I obviously cannot answer with my lack of medical knowledge. So thank you so much, Doctor. I appreciate it.
Thanks, Amana. Great questions, everybody. And we're all in this together.
Yes, ma'am. Absolutely. Well, thank you so much again. And for everybody else and for everybody watching, we will see you tomorrow.